We're back in business.
So yeah, when these people need breathing treatment, they need options. What options do they have? Well, there's three of them. First is what's known as helmet-based ventilation. This is essentially when you look like Sandy from SpongeBob and have a giant helmet placed on your neck in order to get breathing support. It might work, but it's hugely alienating and it's hugely isolated, which we think is a harm for patient comfort. The second way that people get breathing support when they're trying to use these sorts of technologies is known as mechanical ventilation. Slightly better, but now you have a giant tube stuck on your throat, which is both really invasive and can pose long-term health complications. The last option is known as CPAP therapy. You guys might have heard of it if you use it for sleep apnea, and while it's great because it's nearly invasive, if you just put a mask on your face, it's horrible because it allows for the current mask in the market very leaky, which makes it very bad for clinically sensitive situations, and which is why it's hard for use these use cases before. Yeah, there has to be a better way. There has to be a way to get a minimally invasive treatment, one that provides comfort, but also has an efficacy component to it. And this is where AirTight comes in. What is AirTight? AirTight is a retrofit attachment to existing CPAP mask that increases the efficacy for CPAP therapies and other sleep apnea virus for the CPAP therapies and masks as a whole. The way that we do this is in two fronts. First, we fit and adapt to a patient's face. The way AirTight works is that we're a retrofit attachment, much like how a cell phone can slide onto a cell phone, or a mask attachment that slides onto existing mask, then molds to a person's face over time and creates a more snug fit. But the second way that AirTight works is that we create an impermeable barrier that stops viral particles and other materials from escaping out into the environment and posing harm to others before they can create harm within the clinical workspace as a whole. How is AirTight different from the rest? Because obviously we're not the first people to think of this. While there's many different competitors in the market, the one place I would want to highlight how AirTight is different is in the fact that we are a retrofit solution. Rather than trying to reinvent the wheel by coming with a new mask, we're inventing a better mousetrap with this retrofit solution that attaches and converts CPAP masks into more effective and more technically competent quality without needing to break the bank for as many other competitors priced at much higher price points do. What's the value here? Because we've talked a lot about how AirTight is better, but who does it provide value to? First, we provide it to customers because now we're increasing accessibility and increasing the treatment of a minimally invasive breathing support option one couldn't use before, making sure that patient comfort is central to this process. But secondarily, we also add value to healthcare workers. Because for a nurse, it's the difference between going home at night, unsure about whether or not you picked up an infectious disease, or unsure whether or not the conditions you're working in are safe, and going home with better and more secure peace of mind. But then for hospitals as a whole, we also add value because we're able to save hospitals money, and it's the difference between buying a few high-quality products versus buying a lot of them that provide the same treatment of care and allow them to treat a lot more patients when they go to the hospital. So obviously, AirTight has been a project that we've worked on for a while now. We've talked to many different people, be it clinical sponsors, be it entrepreneurial sponsors, continuously getting feedback and continuously iterating and refining our product as we move. But there's also been an iterative process that we've done on the science side as well. So you can see that we've done many different tests to verify the efficacy of our masks. But two things I want to highlight is one, we have clinical study approval within the Hopkins Medical Institute, which allows us to get the testing. But secondarily, we also have FDA pre-approval that allows us to get to market a lot faster than current medical devices or most medical devices need to do because the device is so minimally invasive. What's the business case here? I know there's a lot of numbers on the slide, but the two things I want to talk about here is one, how we're able to sell it at a low price that's been tested based on how we've been prototyping, and secondarily, how we're able to scale the 6,000 hospitals nationwide that could use this product, starting first within the Baltimore area, but then working our way up to the rest of Maryland and then nationally as a whole. So we really see AirTight and this product working both within now the current context of COVID, but now scaling up to other respiratory illnesses, other at-home applications as a whole. And I'm happy to talk about more of those applications and questions. The last thing I want to end on is AirTight and our team as a whole. It's been one that encompasses many different skill sets, leveraging Hopkins engineering, biophysics, and many other communities. And it's one dedicated to gaining traction and one that has proven traction both in the past and moving forward. Thank you.